This is Steve, the Funky Heart, and this is Dr. Mike McConnell, not only just a cardiologist, he's my cardiologist at Emory University. Doc, tell me how things are going at Emory University.
Things are going very well at Emory University. We have a very, very large program now.
I know you can't tell me much because of the HIPAA rules, but the program's growing?
The program is growing like mad. You know, the 1.5% of the United States lives in Atlanta, and we probably take care of maybe 20% of the people with moderate to severely complex congenital heart disease in the metro Atlanta area. And of course, it's the busiest airport in the world, so it's easy to get there for people from around the country.
Okay. Look 20, 30 years in the future, where do you see congenital cardiology then?
I think we have a tremendous amount of work to do. You know, for example, taking Atlanta, there are 50 pediatric cardiologists in Atlanta, roughly, and there are 2 part-time adult congenital cardiologists. But the numbers are there are more adults with congenital heart disease than there are children with congenital heart disease. So there's a huge mismatch between supply and demand. One of the big problems with supply is that training people the additional time necessary to make them competent to take care of adults with congenital heart disease takes a lot of time, and unfortunately it takes people to a different ability to make money, and it's actually lower. So you ask someone to train for 5 more years to make half as much money as they would have made if they'd stopped 5 years earlier. So it's tough right now.
But it is a growing field?
It's a growing field because the patients are growing, but we have to grow more doctors to take care of them.
Oh.